Good afternoon, everyone, and thank you for joining us. I'm Tom Fay, Chief Librarian for the Seattle Public Library, and I'm pleased we are able to honor Mental Health Awareness Month with this important discussion. So thank you for your interest. Before we start, I'd like to acknowledge the land that we're on. The Seattle Public Library is on Indigenous land. These are the traditional and unceded territories of the Coast Salish people, specifically the Duwamish people, past and present. We acknowledge the land with gratitude. We hope you will use the library to study, understand, and reflect in a way that inspires you. Thank you for taking a moment to reflect with us. We're grateful to the Seattle Public Library Foundation and the Seattle Times for sponsoring this event. Donor support for the foundation helps create and expand enriching programs for our patrons, all for free. Thank you to all the library supporters in attendance tonight. As you'll hear, public libraries play a critical and often overlooked role in addressing the mental health challenges we see in our city and our society. SPL is proud of some of our recent efforts to address mental health challenges at all stages, from prevention to service connections to crisis intervention. A good example of our efforts is our new social services team, and you'll hear about these services from Community Resource Specialist Lee Huen. Although social services may seem like a departure from what some think of as traditional library services, the work our social services team does illustrates how we respond to our patrons' information and referral needs. Our library staff make connections to all kinds of information for all kinds of people in every kind of life situation. The library is the biggest referral agency in the city, so connecting people to community resources is absolutely in our wheelhouse. To be clear, this team does not act as caseworkers, and they do not take on clients as social workers. That would be outside of our scope. Instead, they connect people to information, resources, and to each other, a vital service for our residents. The team is guided by trauma-informed care principles and the idea that you can't enjoy full access to library services if your basic needs are not met. We're also creating programs in partnership with communities most affected by mental health crises, such as teens. You'll hear more about that from Program Manager Juan Rubio. And we're also happy that patron use of SPL branches is up across the board. More people are visiting our libraries to get their books, attend programs, and receive these vital services I just mentioned. I'd also like to thank Congressman Adam Smith for being here tonight. In addition to representing much of Southeast Seattle, including 6 SPL branches, he is a published author. We're excited to hear more about his book and his personal experiences with mental health tonight. And I want to note that SPL has copies of the Congressman's book in print, as an ebook, and as an audiobook, which he recorded himself. And when I last checked, all of our copies of the book were checked out. Thank you, Congressman Smith, for your continued support for literacy in our library. Our particular thanks for your support in Congress for increased funding for much-needed upgrade to our branches to increase their seismic safety and climate resilience, including the Columbia branch in the 9th Congressional District. We truly appreciate it. A few housekeeping notes. In this webinar, you can use the Q&A button on your screen to submit your questions for our panel. There will be a Q&A portion in about 30 minutes. Let's start thinking of your questions. If you need any technical assistance, including with captions, please use the chat box and a member of our team will assist you. This event is also being recorded so others can learn from the discussion. With that, I'm happy to turn it over to Taylor Blatchford, engagement reporter for the Seattle Times Mental Health Project, who will moderate our program. SPL deeply appreciates our longtime partnership with the Times on event programming and promoting access to information. We have been pleased to host several public events with the Mental Health Project at the library and look forward to continuing our city's discussion of this serious issue. Thanks, Taylor, and over to you.
Thanks so much, Tom. Hi, everyone. I'm Taylor Blatchford. I work for the Seattle Times Mental Health Project, which is our initiative covering mental and behavioral health. And we're really glad to be partnering with the Library Foundation on this panel. So I'll start by just asking our 3 panelists to introduce themselves and each tell us how their work connects to mental health specifically. And Congressman Smith, let's start with you.
Sure, happy to do that. Adam Smith, I'm the congressman who represents the 9th District of the state of Washington. Healthcare is an enormously important aspect of public policy that I've worked on throughout my career, and mental health is a key component of that. And as many of you know, we've struggled to incorporate that. Congress some years ago passed the Mental Health Parity Act. We're still working to live up to that. The idea that mental health shouldn't be any different than physical health in terms of people having access to treatment to it. So very focused on that aspect of the problem. And as was mentioned in the opening, I went through my own battle with anxiety and considerable experience with various psychiatrists, psychologists, and prescription medications as I walked through that journey. So public policy around mental health is enormously important to me and to the people I represent.
Thanks so much. We can go to Juan and then afterwards to Lee.
Hello, everyone. I'm really happy to be here. My name is Juan Rubio. I'm a program manager at the Seattle Public Library, and I have been developing programs that support teen mental health. And I want to share some slides that is going to help us understand what we've been working on. So we've been creating resources for librarians to create spaces that support teen mental health by the use of co-design and acceptance and commitment therapy. This has been in with support from the Seattle Public Library Foundation and from the Institute of Museum and Library Services. We have created a set of cards that help librarians plan programs to support the mental health of teens with onboarding instructions, warm-up activities that let them reflect what is their thoughts and ideas about teen mental health with topics. And we're also leaning on the co-design methodology to create these connections with teens. We're working with 5 libraries throughout the country who are helping us test these resources with teens in different contexts and locations to see what's working, what's not working, and how we can make them adaptable. And like I said before, we're using these 3 different pillars, which is co-design, always leaning onto the mental health, and acceptance and commitment therapy. We are trying to normalize conversations with teens, to destigmatize the conversations around mental health, and through co-design, help teens to externalize their thoughts and emotions. So we're really excited about what we'll be doing. Thank you.
Hi, and my name is Lee. I use she, they pronouns. I'm a community resource specialist at the Seattle Public Library. And I've been here for about a year, but I've been doing social services for the last 8 years, mainly crisis work with people experiencing homelessness, substance use, and mental health. And how my work connects to mental health, well, I have my master's in social work, but I do refer to myself by that clunky resource navigator title just to make sure I'm setting the correct expectations with patrons and partners for the work that I do here at the library. So when someone comes into the library with questions about how to access shelter or replace their ID, I walk with them through that maze and give them accurate referrals just because the whole system itself is very confusing and difficult to navigate. So being that human person, being that person to give that accurate referral really goes a long way. And while I do have experience in case management, counseling, and assessment, I don't do any of these type of mental health services at the library in this role. However, all of these experiences inform how to make good referrals on the outside and how to have that warm handoff that actually gets people connected to their destination.
That's great. Thanks all of you for introducing yourself and telling us a little bit more about each of your roles. Congressman Smith, in your book, you wrote that mental and physical health problems come down to 2 main things: getting the right diagnosis and the right treatment plan. What have you learned through your journey with mental health and with chronic pain about advocating for yourself when seeking care?
That it's absolutely critical. And that was something that I really struggled with. And I think a lot of people, when they're facing, a physical, I mean, you're in a bad spot to begin with. It's something that you weren't ready to deal with. You're not, thinking as clearly as you would like. And what I wanted to go to a medical health professional who would tell me, this is what's wrong with you. This is what you do about it. And unfortunately, diagnosis and treatment is complicated and difficult, and we don't have the best system for doing that. So you absolutely have to advocate for yourself, and you have to be aware of the fact that you're not just going to get one easy answer. You have to work at it. And I would say also a key part of that is to the extent that you can have support around you, whether it's family, friends, wherever, to help guide you through that. That is necessary. I guess the other thing that I would say from a reform standpoint, and I know, some healthcare providers have started to do this. I mentioned in the book that when you're dealing with the healthcare system, they don't interact with humans particularly well, if I may say so, which is kind of weird. But in the medical profession, it's sort of a science. They think of it more of an engineering standpoint. We would do well to train practitioners more. How do you interact with human beings? How do you listen? How do you hear what they're saying? And how do you communicate clearly? That's not a skill set that a lot of healthcare providers possess. Now, let me say one other thing on the reform standpoint about that. Part of the reason they don't possess that is because of the fact that, we pay for quantity, not for quality in healthcare. We need more family practice physicians. We need more social workers. So Lee, thank you very much. I mean, that's what we need, but you're not compensated appropriately. They compensated by visit. I mean, if they see you for a minute or if they see you for a week, they get paid basically the same. So they're under an enormous amount of pressure to move quickly through every conversation. And we are dealing with complicated problems, particularly, mental health problems, I think, are particularly complicated. Not having that time to truly engage with the patient and understand what's going on before you try to do a diagnosis or a treatment is really costly. And, one last thing. So what this has led to in a lot of cases, particularly on mental health, is the over-medication of this country. I feel very passionately about the fact that we pass out way too many meds. It's quick and it's easy. And I will admit that when I sat down with a doctor or a psychiatrist and he said, this pill should help, I was like, beautiful. Okay. It's easy. Give it to me. I take it. I'm better. Right. So I understand the incentives, but when you're talking about mental health, drugs are not that often the answer. And certainly whether they are part of the answer or not, an in-depth understanding of what's going on with the individual is crucial. And we need to work harder to get to that.
Thanks so much for that insight from your experience. Juan, I would love for you to tell us a little bit more about the deck of cards that you mentioned in your introduction, and how library staff use those to start conversations with teens about mental health.
Yeah, so it's a resource that has different categories. They have a warm-up activities, they have topics. The topics could be, for example, coping skills, it could be, what school or stress factors. And then we have co-designed cards that have activities that help teens express their ideas and emotions or think about their behaviors around mental health. And then the librarians, it comes with a cookbook that helps librarians use the cards, and they do a mix and match to create the structure of a program that then they carry out with the teens, leaning always in this participatory design, co-design aspect, in which kids or teens are working together in terms of like creating something designed by doing, and at the same time then thinking of mental health from a distance, right? So that they are able to see their thoughts from that distance. That is really helpful when you are beginning to create skills around mental health. And I think it's important for us to distinguish this continuum in mental health we are really not at the very end, like at the crisis moment, but actually in the beginning when we are just normalizing the conversations with teens and helping them have these conversations in a way that is natural, that there's no stigma around it, and like in terms of like listening that the representative was saying, we think that through co-design to this participatory design, it's a good venue for us to listen to the teens and see what they're thinking about mental health.
That's great. And when you say co-design, that means that library staff are working with the teens in order to structure these programs or figure out how to go about things?
Yeah, so co-design is a methodology that it's used to create products together, and we have turned it around a little bit. So it's a design that happens in group. And then there are many strategies. For example, you can create a persona, and one of these exercises is a persona building, where the teen creates a third person, and then from that third person, they can put them in a situation, for example, that is stressful, and they can identify behaviors that could happen when they are in that stressful situation, or coping skills that the team can use. But we are creating in that way where there's like that distance. They're not talking about themselves, but this fictional character that allows them to then externalize their thoughts in a better way. And from that distance, that is part of that acceptance and commitment therapy.
Okay, that's great. That's really interesting. So Juan, you segued us well into what I was going to ask Lee next by mentioning that mental health and mental health care is really a continuum from from different ways it affects people, from the more, having conversations around stigma to then the crisis services. And you and Lee work on pretty different ends of that continuum. So Lee, I would love to hear, how does the library view its role in caring for people in mental health crises as part of the city's broader, ecosystem of services?
Yeah, mental health care really goes beyond office-based treatment. That stuff is really, really key and important, psychiatry and therapy. But other things that impact mental health include housing, food, finances, relationships. Mental health care happens in schools as it happens in libraries, and it's all really connected. So if someone's living outside and they're unsure of where they're going to sleep that night or where their next meal is going to be, therapy isn't necessarily going to be maybe the right thing in that time. Having basic needs goes a long way. And so the library really is responding to the needs that we're seeing in the population. And one of the ways they've done that is to hire a very small but mighty team of 3 staff, which include 1 social services librarian, and another community resource specialist. So there's 2, but this is a team of 3 in a staff of like 700, serving 27 branches across the cities, and we're all pretty new as well. And so while we do this work, a big part of it is really connecting patrons to meet those basic needs, and helping people navigate the complex and ever-shifting social services landscape. And then in turn, we also take all of the information that we learn and bring this over to our staff as well. Just because since there's only 3 of us, it's a little bit of a drop in the bucket. We want to know how we can impact staff culture and bring knowledge up to speed as well. And so it means us being trauma informed, and it means us slowly rolling out being trauma informed to other staff as well, to really provide that space for people and allow people to access our work. Something else I really wanted to mention too is that in crisis work, they always say the best time to address crisis is really before it happens. And so some of our work looks like coffee and conversations, where we are serving a light breakfast to folks at the library. And often, these might be folks who are sleeping right outside who come in at 10. And other things we do specifically with youth are our young adult drop-in program, which is actually run by the teen librarians, where we do arts and crafts. And these programs really allow folks to feel welcome in our space and build relationships that are not just transactional and things like that. And so another way this is really helpful too is if a crisis does emerge, we may already have a relationship with the person who maybe is in crisis. And so we already know more about them rather than just seeing them in the heat of the moment. We're like, oh, we know this person likes to talk about this, or we know this is their backup person. And building those relationships is really important in the work that we do.
That's great. That's really important work that you all are doing. So I want to shift gears a little bit and talk about the idea of stigma around mental illness. And Congressman Smith, that was something that you talked about in a lot of depth in your book. Tell us more about your view of why it's important to eliminate stigma around discussing mental illness. And also, have you seen any changes around those type of discussions in the time that you've been a lawmaker in Congress?
Yes, and I think the biggest thing is it blocks the willingness and the ability of people to get treatment because of that stigma. If you're unwilling to seek that help because you're trying to avoid being branded in that way, you're not going to get help and you're not going to move forward. That's the single biggest problem. And the stigma around it also, even before people, actually enter into a crisis moment, their willingness to explore what mental health means is less if it's stigmatized. I mean, one of the stigmas that I had to deal with as I was growing up and going through this was I thought, and I mentioned this in my book, mental health was very simple. Either you were normal or you were crazy. And you wanted to stay on the normal side of that line. As long as you were on the normal side of that line, everything was fine. And that's ridiculous. Okay, that's not the way it works. But the notion that there was anything that anyone could help you with and mental health was something that I resisted. You were mentally healthy or you weren't, and what real treatments were out there, and all of that blocks the ability to seek help. Now, to answer the second part of your question, I think it has changed in a very positive way. You've seen a lot more people talking openly about mental health, and there is now a willingness to discuss it that I think wasn't there before. I think the next step that we need to take, though, is to go beyond a willingness to discuss it and to understand that there are treatments available and you can get better. I worry sometimes that some of the talks about mental health are more about, gosh, this is some horrible thing that has happened to this person and isn't that terrible? When in fact, I view it much more as a good news story. There are treatments out there, and the stigma against looking at mental health, blocks our basic understanding. I have a long, thing on this, which I'll do quickly, but mental health, really comes down to three basic things. One is cognitive behavior. Cognitive behavioral therapy is enormously important to help people deal with normal stresses and strains of life. You can, in fact, change the way your mind and you perceive events. There's a lot of incredible treatments out there right now to help people do that. We all need that. Look, stress, strain, it's going to come at you. How do you deal with it? How do you manage it? How do you know how much to worry about something and how to do it? But the two other fundamental pieces are trauma. Have you had trauma? How do you deal with it? And then second, a basic sense of self-worth, which is a concept that I didn't have any idea about. But if people don't have a basic sense of self-worth, that will cause all manner of different problems. So to understand those basics, reduce the stigma, talk openly with people about it. So I really think the stigma, like I said, two things. One, it blocks your ability to pursue an understanding of mental health because you think if I start talking about it, what are people going to think about me? And second, if you do have a problem, you will go to incredible lengths to try and bury it. I know that I did the first couple of times this hit me. So yeah, that stigma's a problem. It's getting better. Still a lot of work to do.
Yeah, absolutely. Thanks so much. Juan, this is something that you've talked about with your work as well. Tell us a little bit about why reducing stigma around mental health is especially important while working with teens and young adults.
Yes, I think that, in order to solve a problem, you really first need to identify it. And then if we create a stigma around mental health, we're not going to be able to name those problems, right? And as teams become more aware about not only what's stress, but how can you counteract the stress, I think that that is really important. And that is only going to happen if you have those conversations, and those conversations are normal. And then you open the space for them to be open with others. I also think that a lot of mental health support is social, right? Like when you are together with other people, that is really good for your mental health. So we're trying to create these spaces in which teens come and form social relationships with other teens while they explore strategies that can help them build a healthier mental health practices.
Okay, that's great. Lee, I would love to hear from you a little bit about how your role, how you work with local organizations, local service providers, things like that, to make sure that people are getting connected to the services that they might need.
Yeah, a big part of getting connected with other partners, I always jokingly refer to this with my coworkers as like little field trips where we go out and visit other organizations or agencies throughout the city, and we make sure to go there in person, and oftentimes we take public transit to get there. One, I don't have a car. Two, it's how our patrons would be getting to these spots. And so we just want to make sure that everywhere along the way, we aren't losing people, because we know how easy it can be for someone to show up, maybe in a crisis and ask for help and just be given like a list of things or be told to go somewhere else, but to not really verify that that other spot will be able to help them out. And so when we meet with partners, we take notes of little things like, oh, there's a stairway here, like the ramp's going to be on this side for accessibility, or the door is really heavy, like make sure to knock really hard and call this number, and it's a red door, not the one that Google Maps tells you. And so we want to make sure that we get all of these little pieces together. And so when we make these referrals, they're accurate, they're timely, and they are really actually going to get the person connected to what they need. Just because, as other folks have been saying, mental health is very stigmatized. So asking for help in the first place is really tough. And so when folks do ask, we want to make sure that they are given the right information, so that asking another time is not going to be so hard. And we know that the library is a big system and institutions are really big, and we want to be able to develop a little bit of trust there to say like, hey, like I actually see what you're going through, and here's the place that works. If it doesn't work, come back and we'll try again.
Okay, absolutely. Thanks for that. Congressman Smith, tell us a little bit about how your own journey seeking mental health care has informed your work as a lawmaker, which you touched on a little bit when you were introducing yourself.
Well, access, I think, is one of the big issues. And this is true across the board in healthcare, but certainly in mental health. If you have a if you have a crisis that comes up, how do you get access to that basic information up front? Which is why I'm a huge proponent of universal access to healthcare, Medicare for all, whatever the system is, get people covered so they have some place to go. So I'm really very focused on access. And the other part of the access is access to the right type of care. And what I discovered in mental health care is, well, I like therapists and social workers a lot better than I like psychiatrists. If there are psychiatrists on the call, I apologize in advance. There are very important roles that psychiatrists play, but it takes a lot to make a psychiatrist, as they will tell you. Okay. And we need a bigger volume of places to go. Not everyone's going to be able to go to a psychiatrist. And, the cost of getting the degrees and the training necessary to become a psychiatrist are really high. What can we do to really improve the triage piece of it? So that you have a social worker, a behavioral health specialist, a therapist that you can get access to more readily. We need to increase those folks. I'm working with the city of Seattle on their Health One program, which is when you call 911, or I guess 988 now, you can get that type of crisis response unit instead of just a police officer or a firefighter that are trained in entirely different ways. So I'm very, very obsessively focused on access and that basic understanding of what mental health is. And then the second piece of it is, before you get into a crisis, train people in mental health. And we don't really do that. We have physical fitness, you got to take a physical before you go to school, and they'll check and make sure that, everything's working physically. We don't have much of a program in the basics of education, K-12 coming up. And here's what mental health looks like. Here's what you're dealing with. I mean, because when you first experience depression or anxiety, and understand there's clinical depression and clinical anxiety, which is a different thing than the normal stresses and strains, ups and downs of life, but they're both mental health issues. And when you first experience that, you're 6, 7 years old and you got a test coming up and you're like, what does that mean? I don't know what the hell's going on. And if we could explain to them, well, here's what you're going through. Here's why it's normal, and here's some coping mechanisms. A lot of what Juan and Lee were talking about in terms of what they want to provide to people. So access and upfront, really starting to educate people about how important it is to think about mental health in the same way that it's important to think about physical health, from a very young age. So you can educate yourself about the signs and what you need to look for and how you need to make sure that you stay in good, mental health as well as physical health.
Yeah, absolutely. Thanks so much. Just a reminder to everyone that we would love to hear your audience questions in the Q&A button at the bottom of your screen. We're going to have a few more questions here, but then we'll move to audience questions. So please type something in there if there's anything that you'd like to ask our panelists. Juan, back to you. Tell us what you have learned broadly about teen mental health through your work on these library programs.
So much, right? Because it's kind of layered, because we're creating resources for libraries and creating these spaces. So we're always asking questions like, what do they need, right? And one thing that we have learned is that there is a certain fear around providing and opening the spaces for mental health discussions. And that's because it's based on like this stigma, right? Like we also have this concept that we cannot talk about mental health unless you are a professional in the mental health field, right? But that's really not, that's what we're actually trying to disrupt, right? That mental health conversations can happen in anywhere and everywhere. And that we can bring those things to the foreground with teens and create these spaces. But we also have found that the teens really connect with the methodology that we're using, in which they're able to express creatively their thoughts around mental health. And they had a preconception that this was going to be a lecture when we tell them that they were coming to the space. And they expressed how pleased they were that it was more interactive, that it was more about doing things, and it was not about this one-to-many instructor form. So those are just two of the things that we have learned in the process.
That's great. And it seems like the programs that you do in partnership with the teens, that seems like a really empowering approach to take in helping them have those conversations.
Yes.
Lee, what do you think that the general public should know about helping people who are experiencing mental health crises?
Yeah, often people in crisis are really scared. And sometimes this comes off as agitation or anger and things like that. But oftentimes, like a person's just feeling fear. And so this coupled with if someone's basic needs aren't being met, such as safety, shelter, hunger, and some of those other things, this may kind of exacerbate the conditions that people are in. And so something that I really wanted people to know is that when we're seeing people in crisis, as we often do in Seattle, sometimes people may feel discomfort, and discomfort is not the same thing as feeling unsafe. I think sometimes people view others who are experiencing mental illness and they feel unsafe about it when actually it's the other way around. It's like the person in the crisis is the one that's the least safe. And it's actually very normal to feel upset when we bear witness to those in crisis, because it's not, it's like a failure of society, right? It's a sign that we are human and that we view the other person in crisis as also human, and we are upset that they're like that. And so I would say that's really important when helping people in crisis. And also just knowing that treating people with kindness and respect goes a long way. Oftentimes, like, yeah, we're not going to know what to do, but seeing if someone's very little basic needs of like, hey, can I get you something to eat? Or here's some water, and little things like that, and just treating people like people is really important. I guess the last thing I want to mention too is that it took time and policies for our mental health system to really get to the shambles of where it is today. And it's going to take time and money and policy and power to get ourselves out of that. And so I did really enjoy the Seattle Times and KUW podcast Lost Patients that was recently aired here at the library last week. And it gives a really great example of how we kind of got to where we are today, that we are seeing people in mental health crisis just outside of our libraries and in our streets. So highly recommend that.
Thanks for mentioning the podcast. We appreciate that. You can find that. I think we can put a link in the chat, or we can add a link so that people can find that podcast if they haven't found it, looking at the mental health care systems in Seattle and around the country. One last question for all three of our panelists. Could each of you tell us what's one thing that you want people to understand about mental health care and take away from this discussion?
The biggest message is that help exists. I mean, that's the biggest thing that I want people to understand. It may seem like it is an intractable, horrible problem. Help does exist. There are people out there who can help, and you can get better when you're experiencing, anxiety, depression, mental health problems. I certainly doubted that when I was going through for years. I thought there's just no way there's no way out of this. There is. Help exists. Have a positive approach to it, and you can find people who will help you.
I guess I'll go next since that's the order we're following. I think that for me, it's understanding that mental health can be addressed in many different contexts, in many different ways. Not only with the crisis, but also in creating these spaces into preparing yourself, or like Lee said, getting there before the crisis occur. And I think that the libraries are in like a perfect position to help provide those things, because we are embedded in the communities and people connect with the libraries. And so that is like a great space where we can activate these spaces to create awareness and literacy around mental health.
Right. Not going to say anything too different than Adam and Juan, but the same thing, that mental health exists so much more than just mental health facilities and offices and things like that. It's very holistic, and we have to think about everything that really comes together to impact a person's mental health. Those are all the things that are going to help alleviate someone's mental health status as well. And also another message is that, like, you're not alone. We're not alone in this. We have each other, we have community, and the library is just one of those places that people can either get together or learn more about the resources they can connect to.
Thanks so much. So we're going to move into a few audience questions now. Thank you to everyone who's submitted questions in the Q&A. One question for any of our panelists. We referenced 988 as a number to call when there's a mental health crisis, and an audience member was asking to clarify whether there's a different number than 911. Would anyone want to share a little bit about 988 and how that service works?
Yeah, I visited a 911 call center, and basically When you call 911, the person answering the phone is very knowledgeable. Okay, they're not just an operator moving you through. They've been trained in the questions to ask, who to deal with, identifying what the crisis is, where the help is. 988 is the same thing, but for behavioral health crises. So, yeah, from a policy standpoint, and this was all happening, it's debatable whether or not we needed to create 988. We certainly needed to create behavioral health response people. You can call either number and you will get the help. I don't want someone sitting there in crisis going, yeah, well, which one really fits here? No matter which number you call, the person who answers that is a highly trained professional, trained to know and to ask the questions to figure out, okay, what's your situation and who do I need to connect you to? I will say the positive about 988, as I said earlier in reference to Health One, is it recognizes that, there are crises out there that are not law enforcement or fire related. They're mental health related, and you need a particular type of person to respond to that. So either number is fine. 988 is what is more focused on the mental health side.
Thanks so much for sharing that and clarifying to those who might not be familiar with that system that was added, I believe, maybe a year and a half ago. So still relatively recent. Yeah. A question from an audience member for Lee. With the library beginning to delve more into offering mental health related services, why should those services be located at the library rather than building mental health facilities? Can you talk a little more about the distinction and what makes the library a helpful place for that?
Yeah, I would say mental health facilities should totally be funded and created as well. We aren't doing that type of mental health work where we do like counseling, therapy. We're not going to check out medications to people either, just books and DVDs. But we are the spot where people might learn about these services and a connection for referrals and things like that. So I would say, yes, we should fund both of them.
Sure, that makes sense. So it sounds like you're saying that they play different roles, and the library can be a place that people can come to get information about some of the more in-depth facilities or residential services or things like that.
Definitely. And some of the things we might be able to do is in building relationships with other partners, we can kind of see where people's capacity is at too. And so a lot of places are over capacity, but we might be able to think, oh, like this program might be, there's a small window where they're taking folks on, and we may be able to do that resource referral. But again, we're not doing mental health like specific care here, just referrals and resources.
Okay, that makes sense. Thank you. A question for Congressman Smith. How can we, the audience, help in advancing legislation for mental health access?
Well, I think forums like this and working with whoever you can to raise awareness. I mean, look, legislation, and I get a form of that question. I've gotten a form of that question thousands of times throughout my career. And the simple answer is you need to lobby, advocate, build support. And there's 1,000 different ways to do that. But the more public awareness there is, the more people will pay attention to this issue. And that means certainly, I do meetings. I saw someone mentioned NAMI on here, National, I forget exactly what it stands for. Yeah. But they work specifically on mental health from a public policy standpoint, supporting them. They raise awareness and raise education. And then if you want to get into specifically what do you want to advocate for? Well, that's a more difficult conversation in terms of figuring out what the specific policies are. I would urge you to go to mental health advocacy groups and support them, support what they're doing, and help bring attention to the issue. And I think, and that's why, frankly, I think the libraries are so important. You can't just put mental health in a box. Okay. It's like, well, this is a mental health thing. No, we need to make everyone aware of what's going on because information is such a huge part of that. So raise awareness in any way you can.
That's helpful. Thank you for that. For either Juan or Lee, whoever wants to answer, someone asked, how can mental health service providers in private practice who might not be attached to hospitals or other larger organizations become a resource and partner with the library?
I mean, we're always, I think like what I mentioned before, that this effort should be a community effort, right? And then we're also learning from everyone in the field. I partner with some researchers from the University of Washington, which provide incredible guidance for us to think about implementation of programs or development of resources. So I think that we'll always welcome, right, partnerships and collaborations with other fields. And really value them, right? Because not only welcome them, but they really provide an extra layer of support that that is really necessary for us to create something that is very carefully planned, thorough, and at the end impactful for the communities.
Sure, absolutely. One kind of on that note too for Lee, a library worker asks, how do you suggest keeping up with the really complicated and ever-changing system of resources that are available? If someone's, trying to connect folks with support, but they're not working in this world every day, how do you suggest that they stay up to date with that?
Yeah, I would say something that I thought was beautiful when I started a year ago is that a lot of our branches were already connected to a lot of local social service orgs. And so kind of like I know that the Ballard branch was already doing visits over to the Ballard Food branch, and they were having staff rotate out and see it in person. And so they were already doing this type of work just as library workers. And so I would say learning what the local partners are, if there's time in your schedule to step out and really like meet those people in those other places at their physical locations, great. If you can only do a Zoom call, that works as well. But I'd say one place to really start, depending on where you're at, is just to see like local, like online newsletters of different places. Like I know Solid Ground has like a really, really great newsletter where they just talk about different social services. And so kind of signing up to some of those newsletters, attending resource fairs, going out and see local places. It definitely takes time to build up this network. And like, I think some information is better than no information, and really just going out there and seeing what's there and introducing yourself.
Okay. Yeah, thanks for those suggestions. That's helpful. For Juan or for Lee, an audience member is asking about how the library serves folks who are neurodivergent, or specifically those who have autism spectrum disorder. Are there programs or protocols that Seattle Public Library has for helping this community?
We haven't created one like specifically target for that, but we have encountered some participants who come and join the program who have autism. And at a library we're working on with in North Dakota, is that the Morton Madden Library. They welcome one of the teens who had autism, and then one of the things that I love about librarians and library work is that the intention is always there to help. So they adapted the program and created the space for the teen to participate, and provided that like a specific support to integrate the teen with the other members of the group.
Okay, so it sounds like this is something that libraries are doing on a case-by-case basis, or thinking about, but the Seattle Public Libraries doesn't have like a formalized program yet.
Not with the teams and the programs that I am developing.
Sure, okay. One last question for anyone who wants to answer. How do you recommend broaching the subject of mental health and self-care in the workplace in a way that's professional and respectful of people's privacy.
I don't know that I'm personally qualified to answer that question. I think I obviously I'm a boss. I've got offices, I got people there. I think there are a lot of people who understand more about workplace rights and how to do that. I mean, the only answer that I would have would be openly and respectfully, and carefully. I think if you're in a workplace presuming to, want to raise that issue with somebody, I think you have to respect their space and where they're coming from. But again, once a year I take a workplace rights thing that covers a lot of ground. I would urge you to, get someone with more professional experience about that than I. I don't know if either Lee or Juan have any experience in that area, but I would feel underqualified to answer that question.
It's a big question, right? Because it's a big question. Some of the things that we have found is that helping others helps you. So when the librarians are going through these exercises and introducing sort of like a strategist to deal with your mental health or to have conversations with mental health with teens, it's also helping them or helping, for example, for me, it has helped me tremendously to learn about all of these things, the use of metaphors to deal with mental health situations, right, etc. But it's something that we want to measure a little bit better in the future. It's like, what impact is it having in library staff, the actual use and implementation of these programs with teens?
Thanks for sharing that, both of you. That makes sense. Well, we're going to wrap it up now. Thank you to all of our panelists, and I will turn it over to Sharon Hamill from the Seattle Public Library Foundation Board, who will close us out for today. Thanks.
Thank you. Thank you, Adam. Thank you, Julio. Thank you, Lee. Thank you, Taylor. Thank you, Tom, who started us off. Mental health is such a broad aspect of our humanity. And you really all did a fabulous job of sharing your insights and providing lots of topics for further conversation. I really appreciate your focus on access. I appreciate your focus on sort of meeting people where they are and treating them respectfully. I think that, the work that the library is doing and the library is doing with the Seattle Times and Seattle Times is doing with KUOW. We have a lot of people in this area and a lot of resources, but until we get rid of the stigma around mental health, until we can, talk about it more as part of our humanity. And like you were saying, Adam, not just have a physical checkup to go to school, but also, have an opportunity to talk to people about what's going on with you. We just have a lot more room to grow in our capabilities and our acceptance and our work to, greater facilitate all of this. The foundation is proud to support all of you and all of your efforts. And I just really want to thank everyone for coming here and listening. And I would really encourage everyone to re-listen to this webinar, because so many ideas came up that we could all stand to have reinforced in our lives. So thank you all very much. And thank you for all the work that all of you do and will do to help us be more human in our lives. Thank you.
Thank you.
Thank you, Adam. Thank you, Lee. Thank you, Juan. Taylor.
Thanks, everyone.
Thank you.
Thank you all. Have a good night.
Good night.